Today is Sunday at ASH 2019. I'm in Orlando, Florida. The weather is great, and I can't even believe how much more information I learned today. And I don't even know how I'm going to share it all because there isn't enough time. And I promise you I will follow up with posts and with a written blog. But I know I told you yesterday to hold on, but you've got to hold on even tighter today because I just have so much information from so many different sources. Here we go. So I heard over and over again, and this is such great news for all of us as CLL patients, that the future of frontline treatment for CLL is bright. There are so many studies that were presented between the last few days and even more today, and for relapse patients as well. For most, they're suggesting targeted therapies, which would mean not chemotherapy, but targeted therapies for some novel agents. With all the data that will be generated, it's going to be almost difficult for us to choose what treatment to go on, which I'm going to tell you a little more about. I'm also going to tell you about some sightings of different people in the CLL world that are here, kind of our rock stars, and some that I interviewed that you'll be seeing later on. But with all the data that's being generated due to the evolution of being able to separate cells, they're going to be able to predict more and more, and this is how they'll know what treatments to put us on. They'll be able to better predict as this continues to evolve, which treatments, which combination of treatments, which antibodies they need to look for us, or if we need BTK inhibitors or BCL2 inhibitors or both, or CD20 antibodies. The new ways of testing, and as they continue to evolve, we're going to help separate all those things and identify what will work best for us for treatment. Now, the decisions being based on clonal decisions, there was an extremely beneficial presentation today by Dr. Jennifer Woyak of Ohio State University, and she gave probably the most eloquent presentation I've seen and heard since being at ASH. She had put on a display every CLL patient's dream, and that she put everything that's out there right now for treatment, and she had it listed. And then she had it listed in how it works for different, different combinations with the survival rates and what works best for what things. And if you're, let's say, if you're a younger fit patient, what works best right now. If you're, say, an older patient who's fit, what works best for them. And she even went to the point of, let's separate all these things out. And if you have 17p deletion, that would be added in. Or if you're perhaps older and not so fit, that would be listed too. And this was one of the most beneficial things. I wish that I could show it here, but I only have it on my laptop and on my phone. So it's something we're going to have to post for you on Patient Power because it is so helpful. I know you're going to really like it, and it's going to help you in the future determine which kinds of treatment, at least as of today, because things are moving so fast. There will be more developments probably by next week that's happening. Well, maybe not next week. That's a little overstatement, but soon after. So there were other things. They also talked about intangible things you should consider for treatment, which doctors are getting better with the doctor-patient relationship and discussing this. And even the cost of treatment was brought up. Not how much it does cost. We all know it's going to cost quite a bit. But it was brought up that that is a consideration for some patients who don't have insurances, and that's something that will be needed to look at. But that's okay because there'll be a lot of choices out there. What I also loved about some of the presentations today is there were really like real life things that were presented, such as why do some patients stay in remission and others don't? And it looks like you're the same on paper, and maybe, but obviously you're not. Why do patients relapse? Why do other patients not relapse? Why does it take one 10 years and they were on the same treatment as someone else and it takes them 17 years? So more on this clonal evaluation and the single cell determinants will be coming out more and more as it gets studied, and that's going to help all of us help determine the best treatments for us. So all the novel therapies that we keep hearing about, those are the future. Chemo is not dead. I keep asking everyone, is chemo dead? It is not. Chemo will remain at least for a while, and there are some groups that do better with it. So here are some of the studies that I heard about today and some of the results, and I'm going to try to go through these rather quickly because there are just so many. So, the venetoclax and obinutuzumab, they found to be more effective than chlorambucil and obinutuzumab. And this is pretty much for everyone except for those who are IGHV mutated. It may be a different case. So finally, something that works better for unmutated, but with some mutated, it will work. Anti-CD20 antibodies may be better combined with acalabrutinib versus ibrutinib. I know they're both BTK inhibitors, but on this, acalabrutinib works better than ibrutinib. Using a BTK inhibitor and an anti-CD20 antibody is more effective than chemotherapy with unmutated IGHV patients. But it may also be effective for some IGHV. There's mutated. So they're still studying that, but right now it's looking hopeful for unmutated more. As far as sequencing, there is a great summary of what happens when you in other words, sequencing, like what you take first, what you would take sequentially. So for sequencing of these novel agents, what would happen is, for instance, let's say you were originally on venetoclax for treatment. You went off treatment, you relapsed. So you would go on ibrutinib. That particular combination, by the way, so far in the trial has had 100% progression-free survival. That's fantastic, 100%. I'm just blown away by some of these numbers. The Captivate trial, which I spoke of yesterday, and it's well named, by the way, because it seems to have captivated everyone I spoke to. This seems to be the biggest buzz still at ASH. And the Captivate trial, if you recall, was ibrutinib and venetoclax. It was led by Dr. Nitin Jain at MD Anderson, who I did get to interview today. And you'll be seeing his interview in a while on Patient Power, not today, but it's still the buzz. And the reason is that it's getting great results and it gets better over time. So you remain on this trial and your progression-free survival rates continue to go up and up. Some other news that happened that I did not get to share with you yesterday because I ran out of time, and I really want to make sure I get to it because I know we have a lot of older patients out there watching. So there was a study done with the use of ibrutinib on patients who are on Medicare. So they're in a certain age group if they're on Medicare. I believe it's 63 and above. And it's astounding the numbers, the increase in the use of ibrutinib with this group. Back when ibrutinib was new, it was in 2014, 7% of Medicare recipients who have CLL were on ibrutinib. My God, fast forward, it went up to percent of those patients, and now it's even more because the study, this particular study closed a while ago. And this was based on 13.6 months of usage of ibrutinib. It's a real world study of people on it, but there were some surprising results on this, although you won't be surprised that the costs are skyrocketing on Medicare for CLL patients, not for what we pay, but for what Medicare is paying out for these patients. It's now the most used drug for CLL patients who are on Medicare. And it's good to show that they're not making patients go on old treatment therapies just because they're less expensive. But here's the kind of surprise here in the room. For the real world survival is not as good as it is in the trials. And I'm getting my time cue, so we'll learn more about that on my next broadcast. But I just want to tell you that hope is really huge here in the halls at ASH. I asked about a cure with some of the doctors, and Dr. Jennifer Wyack was really wonderful in what she said. She hesitated and she shared this. With all the trials, we're hoping for a cure in each and every one of these, but perhaps we need to look at it as just another chronic illness like high blood pressure, and you just have to take a pill a day without bad adverse events, having a wonderful quality of life. And she's confident that will happen as all the doctors have great hope for us as CLL patients. thank you for joining me today. I hope you join me again tomorrow, Monday, at 5:30 Eastern Standard Time on Patient Power's Facebook. Thank you.